Doctor, welcome back. So good to see you.
Thanks for having me back here.
And Kathy, nice to meet you. And we're going to get your great story in just a bit. But first, doctor, there might be people out there who they know of cataracts, but they don't really understand what they are. Will you kind of walk us through that and how the problem occurs?
Sure. So a cataract is the clouding of the natural lens in the eye. And this occurs as you get older. It usually starts in your mid-50s itself, and it progresses as you get older. And what it is that when you are young, the lens is very clear, and then as you get older, the proteins inside the lens degenerate and it turns cloudy, as you can see in the picture here. It turns into this yellowish, brownish color that doesn't allow light to be transmitted clearly. And so symptoms for patients can vary from having a general fog to smokiness of objects, and images are not very clear. People have trouble with reading and not being able to see without enough light. And then also, driving at night can be a problem, as you can imagine. So, you know, the street signs aren't very clear, and then you get glare and halos from headlights as well.
And then talk about the treatments and even specifically cataract surgery.
Sure. So in patients who are having difficulties with their daily activities, whether that's reading, driving, or any activities that they enjoy, that's when we usually recommend cataract surgery. And cataract surgery has become a very sophisticated surgery and safe for patients, with over 3 million procedures being done in the United States every year.
Wow.
And it's an outpatient surgery that patients do very well with, and it only takes about 15 minutes with mild sedation.
Incredible.
And over 98% of patients get an improvement in their vision with the procedure. And as you can see, this is an image of how the surgery is done. With 2 small incisions, we open up the cataract's capsule, and then a ultrasound probe is used to break up the cataract into pieces, and then on the bottom you can see we put an implant inside the eye, and that ultimately allows the patient to see well after the procedure.
And Kathy, what led you to Dr. Vira? What was your story?
Well, I had been seeing my regular eye doctor for a while, and my cataracts only started a year prior to my surgery. And she was like, we don't need to check it out now, it's okay. But it got worse very rapidly.
Wow.
And I
It's
actually—
so scary.
It was scary, and I actually stopped driving at night. And then we had that ice storm, and I was home one day, and I could not see to do some work at home. And I called her. She was working that day. I went over, and she said, it's time. So that's, and she recommended Dr. Vira, and that's how it all started.
Yay. And how are you now? And what was the whole process like?
The process was wonderful. It really was. The first one, I didn't really know what to expect, and so there was like a little bit of discomfort afterwards, and I, saw some like shadows in my eye. Dr. Vira called that first night to ask how I was doing.
It was so sweet.
I know. Well,
it's great.
It was wonderful. Yeah, it was wonderful. I mean, because that's so rare to have somebody. I mean, I don't know how many surgeries you do in a day, but that's a lot of phone calls at night.
It really is.
And so it was really nice, but I really didn't start like seeing well and seeing everything till a couple of days later. And I called. It was the weekend. I called, and the nurse called me back. But then Dr. Vira called me back, so that was really great.
Yeah.
And then my second one, I had no issues whatsoever, no discomfort.
That was it.
Yes.
Within a few days, they're seeing well again.
The next day, isn't it this following day?
Yeah, I mean, we see you the day after surgery.
Vision.
Yeah.
Like, they were shocked.
Yes. And are you driving now at night?
Yes.
It's like you feel like you got your life back.
Right. No contacts, no glasses, nothing.
That's incredible. Yes. And Dr. Vira, any precautions during the recovery period that patients really need to be aware of? What were you kind of saying? Make sure, Kathy, you do this, and that, follow these procedures.
Sure. I mean, Kathy had a very quick recovery, so within a day or so, you're able to see pretty well. But what I tell patients is that just be careful, make sure that your eyes and your face is clean. And of course, for women, I also advise don't wear makeup for the first week itself, because you don't want to get anything dirty into your eye. And then other things I mentioned to patients are don't lift anything heavy, and just take it easy for the first week itself. And then recovery is pretty quick. You're able to go back to your normal activities, whether that's work or your household chores, and pretty much the next day itself.
And Kathy, anybody out there who's listening and considering cataract surgery, any pointers for them?
I've referred lots of people to your clinic, and I really highly recommend the lenses that I got, because if you're going to go through the surgery, this is what you have for the rest of your life. You might as well be able to read paper, read the computer screen as well as be able to see really well.
Back it up.
Okay,
you don't need
sorry.
readers?
No.
So Kathy chose.
Oh, I'm so jealous.
Kathy chose to get what are.
You too. Pick up the phone and call now.
Kathy chose these lenses that are called multifocal lenses, which have been around for some time, but it gives the patient a chance to be able to see things where they don't need glasses or have to be as dependent on glasses anymore. And so we are now able to offer that technology to our patients.
That is unbelievable. And doctor, besides the cataract surgery, quickly, make sure everyone knows all the wonderful services that you also perform at the office.
Sure. So in addition to seeing patients for cataracts and cataract surgery, I also see patients for other eye conditions such as diabetes, glaucoma, dry eyes, and macular degeneration. And I also see patients for LASIK consultation and surgery and corneal diseases and corneal surgery as well.
And I know you have a lot of people that are watching that work throughout the week.
Sure.
So how can they be served as well?
So what we just started offering to our patients is actually Saturday morning clinics. And this is
wonderful. Wow.
For the patients who are not able to come and see us during the week. We are just starting to offer this in 2 of our locations in Marietta and Cumming.
So important, yeah, because during the week, by the time they get off, you know, businesses are closed.
Right.
So to have that edge and to know that they can get the help they need is incredible.
Absolutely.
And then you have several locations. I know you have a new one opening up soon, so tell us all about that.
Yeah, so we have 5 locations currently. We have them in East Cobb, Johns Creek, Cumming, Beaufort, and Canton. And we're opening a location in Alpharetta this December itself, so we're excited about that.
Good. And then you have a great offer for Atlanta and Company viewers.
Yeah, we're offering our patients who are calling in the next 24 hours $500 off of LASIK itself.
Incredible. That's $500 off for anyone who calls in the next day, 24 hours. And thank you so, so much. Kathy, great meeting you.
It's nice meeting you too.
And I'm glad that you're doing so much better and
Thanks.
finally seeing clearly.
Yeah.
Well, it makes a big difference, right?
It's an enormous difference.
Yeah.
I mean, it had gotten really bad, and it is lovely. It's exciting.
Good. And if you want more information about that awesome special, please simply head over to MilanEyeCenter.com. That's MilanEyeCenter.com. Thank you both.
Thank you for having us.
Thank you.